Hey there, this is Emily Haig. Welcome to the Hey There Thrivival podcast. Today, we are diving deep into the world of pregnancy and postpartum body care with someone who knows the body inside out, literally. She's a highly accredited pelvic floor whisperer and go-to guru for new parents, a multi-location physio owner who is also passionate about enabling a holistic wellness experience for mothers with their medical professionals as well as physios. She's also running her third conference, and just to ensure she's not bored, she's a mum to two and currently studying medicine. Jo, it's great to have you on the podcast. Could you give the audience an overview on who you are and why it is you do what you do?
Sure can. Thanks so much for having me. My name's Jo Murdoch and I am a pelvic health physio, and I've been practicing that for a very long time now. I incidentally landed there as a young physio, and I guess the reason why I stayed there was because I quickly learned that A, the female body is really quite complex, and B, when you do things well in terms of preventative management, but also treatment, you can really have an enormous impact on not just the woman's body, but her life. So it's that impact that we continuously keep having, and the feedback we get from women around literally changing their lives by doing what seems to us simple things is really powerful and really important, because women are really important. And I have two girls. That makes me even more motivated and ambitious to make sure that female health is high on the agenda.
Fantastic. I love that passion, and we're going to get in a little bit more into some of the things you do and some insights as we go through. Can't wait to run through all of that. And do you want to go through a couple of your accreditations as well? Because I know you're highly educated, so I'd love you to share that with the audience as well.
Oh, sure. I suppose I am highly educated. I've done the postgraduate training in pelvic health, which is what we need to do as physios. And then I went on to do a master's in women's health medicine, it's called, UNSW, which is excellent. I suppose just more detailed information for us to understand. I'm doing a PhD at the moment as well, which is because we have this enormous question, which we can maybe get into later, that we've had in Physioland for a really long time, that really just needs answering. So I'm busy with lots of my colleagues helping to try and answer that. Mm-hmm. And I'm in my third year of 4 studying medicine. So with the hope to go on and study obstetrics and gynecology one day.
So you just love to be bored.
I just love to learn. It's good fun.
Yes, well, especially in your field. I imagine there's many new things coming through, or opportunities to find much more holistic and impactful. So that's
Absolutely.
Fantastic. I think that's the best way to do things, isn't it?
I think so. I mean, the more you learn, and I'm sure it's the same for every profession, the more you learn, the more you realise you don't know. So as soon as you're opening up more learning opportunities, you dive into that, and then you're like, far out, really didn't even know that I didn't understand that. And then so it keeps growing and growing. So it is women's health, female health is, as I'm sure all of your listeners hear all the time because it's kind of out there in the media, it's that we're an understudied phenomenon, the female body. Mm-hmm. And there's just truly so much we don't know about how we function. And so it's a cool, exciting place to be, to really be part of trying to understand it really well so we can do a better job for our girls growing up.
Yeah, I have heard that. I actually heard recently a scientist saying that one of the reasons women haven't been studied, and instead of studying women, they've done men and then applied it to a smaller body shape or things like that, which is, wild, because we're hormonally and physically so different and proportionally weighted. I have heard it's because we're so much more complex to create control groups because of hormones and
exactly
the time in your menstrual cycle. And so it's just being completely ignored, which is absolutely wild. Lucky to have someone itself that's doing it, and there's some great stuff happening. I'm excited for the future. I think it's good times ahead.
Absolutely.
let's jump into the first piece I'd love you to go through is just a high-level overview of the main categories of which physios help pregnant or even preparing to be pregnant, and then postpartum mothers and families.
Yeah, sure. I'd love to. Physios are big on preventative health. I don't know if any of your audience have been to see a physio, but our favourite thing is to try and catch something before it happens, because you might treat an injury or a dysfunction, and that's fine. We're good at assessing and treating that. But often in doing that, there's a big part of we could have prevented that if we did X, Y, and Z. So I love that you brought up even pre-pregnancy, because there is a piece there, I think, for all pregnancy, whether it's pregnancy with a singleton or you're pregnant with twins, but that pre-pregnancy piece, if there is any dysfunction in your system, in your body, particularly your pelvic floor, because I guess that's our area, but it's excellent to have all of that assessed and sorted even before pregnancy. Now, it probably will surprise most of you that the biggest population of women who leak urine, so stress urinary incontinence, are female athletes that have never had a baby. So I just think that's really important. So if you're sitting there going, oh yeah, I guess I did leak a little bit when I played tennis, or that's a thing, and that's, I guess, a little sign for you to be, well, maybe there's something that I could fix in my body pre-pregnancy. So because pregnancy and childbirth have always been blamed for incontinence, I think, as a general understanding. But in our clinic, we see so many women who've never had babies with other things, and the incidence of leaking is really high. And I think people don't necessarily really think that hard about it. It's not that bad. It's the one of the things you can either ignore, or you just stop playing tennis, or you just, and so then you fall pregnant and suddenly you're leaking in your pregnancy, and it's a pregnancy-related stress incontinence. But actually it's not, if you really understood that patient's history. So pre-pregnancy, if you've got any symptoms in your body like stress urinary incontinence, even fecal incontinence we see in athletes, pelvic pain's a big one, so pain in and around the vagina, pain with intercourse. If you have a history of endometriosis that you know about, or even polycystic ovary syndrome, all of these little things have nuances within your pelvic floor that it's really amazing as physios if we can meet you before you fall pregnant and fix all of that, or help you fix that. And then hopefully we prevent the leaking in pregnancy. We prevent the pelvic girdle pain in pregnancy, which is often quite debilitating for a lot of people. So that would be probably the first message, I think. Mm-hmm. And then the second one is the top tips in pregnancy is also about preventative healthcare. If you can get to your pelvic health physio after your 20-week scan, because it's at that point we know exactly where your placenta is, or placentas plural if there's two, and that they're out of the way of the cervix, which means we can do an internal exam, and then and that's how we would assess your pelvic floor and whatever else we need to assess in your body, with the view to prevent, again, pelvic girdle pain or any incontinence or any issues through the pregnancy. And then later on the pregnancies towards the birth, we would assess the pelvic floor again with a different sort of purpose, which would be more around understanding whether the pelvic floor is doing what it should be doing for birth, which I can talk about now or later. But that would be the highlights. And then the third thing would be in pregnancy, we would also be assessing your abdominal wall, and we would be figuring out, really important, because like exactly what you did too, Emily, the big diastases or separations that happen postpartum are really preventable, even with multi-pregnancies. So even with 2 babies or 3, it really depends on what you're doing with your abdominal wall in pregnancy as to how well we can control it and basically stop it becoming a big deal for you postpartum.
Yeah, wow. I mean, it's crazy listening to you talk about this, because I, as an example, just had no idea about how you could prepare and avoid things. I knew about Kegels, but most of the other things, that stomach, that is a preventative thing. And then the birth, a great call out to the audience. You may have no idea, if you haven't had another pregnancy, what might be coming for you in terms of physical impacts will then go on to affect your life and potentially your mental health as well. But getting those checks with someone who is an expert is definitely worth it, because the cost and the time that it then takes to fix it later, which is doable, I imagine is lesser than preventative.
Absolutely, that's right. It's time well spent, preventative healthcare, as you know. And just in case I forget, on the Kegels thing, because everybody knows about Kegels, which of course was some American doctor way back when that discovered that the pelvic floor muscles actually have a function, and we should make sure that they're maintained and strong. But we don't really use that term Kegels in Australia, but it's good for you to use it, because people know what that means. I would say, even if you think you know what you're doing when you do a pelvic floor muscle contraction or a Kegel, I would still get that assessed, because the amount of people we meet, we're like, oh no, that is not it. And it's a real skill to understand how to use your pelvic floor muscles well. So it can be just a simple assessment to really make sure you understand how you do it. So I'll just get that in there in case I forget to say it later.
Very helpful. I mean, it is a little bit of a mystery, I will say. We'll dive into that a little bit later, but really good call outs at the start around the high level areas that physios work with. Let's jump into pregnancy by trimester. Let's say we've got a new parent or expectant parent, or maybe someone that's doing it for another time and they just never had the information. With the 3 phases, so trimester 1, 2 and 3, 3 obviously just about to pop, trimester 1 you're preparing to, on the way. What would you say are the specific kind of muscular changes and how it impacts the physical state?
Yeah, sure. Good question. The first trimester's not tons. You get a big dose of hormone, right? So big dose of estrogen. And there's another hormone called relaxin that you also get a bit of a dose of. It's funny. It's always been blamed for ligament laxity. So if you talk to someone who doesn't know really what they're talking about, they'll say, oh, that's just the relaxin making you all floppy. And well, it's not at all the relaxin. I think because of the name of it, it's taken on this responsibility, but it's not. It's the estrogen is the bigger part, and maybe a bit of relaxin, but it does make your ligaments in your entire body, because estrogen's a great hormone, but it can't target things exactly, specifically, but it will make all of your ligaments a little bit floppier, which means that the ligaments holding your pelvis together can become a little bit more mobile, and your pelvis is suddenly a little bit more mobile. So that can happen in the first trimester. Nothing much is happening to your muscle system unless you are really sick and you can't get off the couch, which I'm sure lots of people are or have been, and so know what I'm talking about, and that's hard, and obviously you're going to lose a little bit of muscle there, but not a big deal. I would say the first trimester is a little bit like just get through it. If you are suffering early with pelvic girdle pain, then again, don't put up with that even if it's a little bit of pain at the front of your pelvis or a little bit of pain at the back, it's exactly what you said before. If we were to see you then we might be able to sort you out in 1 treatment, 2 tops. The women that wait that we see, and they don't come and see us until they're already with a walking stick or on a crutch, we can definitely help and we can get you through the pregnancy, but we could have stopped that happening in the first place. And the pelvic girdle pain, again, it's been a bit shut down, like, oh yeah, it's just part of pregnancy, of course, your ligaments are all loose and blah de blah. But again, not true. There's heaps of women that get through pregnancy with no pelvic girdle pain with the same ligamentous laxity.
Wow.
So it's not a just expected thing of pregnancy. It's something's not right with my body. I need to get it sorted because I've still got 6 months plus to go. So we're big
afterwards as well, right?
And then afterwards, exactly, that's right.
And then you've got new babies. That's what I never really got.
Yeah, and pelvic girdle pain is not, it actually can be quite complex. It's been simplified and shut down, I think, a little bit, but it can be driven from anywhere in your body. So if you've seen a physio and they just put a belt on you without really assessing you, I would argue go and see a different one, because that's just a very generic kind of treatment. Get someone to assess your whole body properly and try and understand where this pelvic girdle pain is coming from. And then the treatment will be targeted appropriately and you'll get better, and we'll keep it away for the rest of the pregnancy. It's really common for pelvic girdle pain to be driven from the upper part of your body, which sounds weird, I know, but if you think about it, your rib cage, your boobs, which are growing, you're tired and you're probably still working, and your top part of your body's really heavy and it's often quite dysfunctional on top of a pelvis that's got to try and carry it. So we find in our clinic more often than not, it's the upper part of the body that's the problem, sitting on top of the pelvis. Whereas that's not really how it's taught to a lot of people. So just really make sure if you've got pelvic girdle pain, go get it checked. Make sure you're not someone just puts a belt or tape around your pelvis and tries to hold it together, because it could be that there's a more complicated problem. And it should be getting better. The way to know is you should have one treatment and it should be even a little bit better. You might need another one, and it should absolutely be getting better, because I think that's the other thing. People are, oh, well, it didn't get better, but I was getting heavier in my pregnancy and la, 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 la. And I go, no, you just didn't have the right treatment. So don't put up with pelvic girdle pain in that first trimester. But that's about all. Nothing too exciting from a physical point of view.
Some really good insights. So first of all, mind-blowing to hear that there's pregnant mothers on crutches and walkers. That's wild. And then quite interesting as well around the pelvic girdle pain, or any pain that it's a sign from your body and it's driven from somewhere. I think that's something I realised postpartum, finally, accidentally, we'll get into my story, but accidentally getting assessed, that everything's interconnected and your body gives you signs. So really interesting call outs there. And what about those last trimesters as you go through?
So second trimester is often quite smooth. It's a really good time, hopefully, if everyone's starting to feel a little bit better, to really get into your exercise. So there's plenty of evidence now that there is just no harm to keep exercising in pregnancy. So when I was pregnant, the rule of thumb was you can keep exercising the way you've always exercised, but don't start anything new. And that's been challenged a lot in the last few years, because actually, like every health condition known to man, exercise is often part of the cure, right? So it will prevent gestational diabetes. You'll look after your musculoskeletal system. There's even some evidence that you'll have better birth outcomes. So if you're feeling pretty good in your second trimester, it's get exercising. So get walking or get running. If running's what you do, get back to the gym, do your resistance training, get in the pool, swim, Pilates like you did, whatever exercise floats your boat, do it, and do it regularly 3-4 times a week if you can. I mean, it might be tricky if you've got other children at home, because it's always tricky to find time to exercise. So obviously take what I've said with a grain of salt, but if it's first pregnancy and you just have yourself to look after and try get to the gym 3 or 4 times a week.
Blissful time then without
without it. Yeah, that's right. But I suppose the point is now's a really good time to exercise. And as I said earlier, it's somewhere in this trimester is when I'd get to your pelvic health physio, because we really want to assess your abdominal wall. We want to make sure there's nothing we could do to prevent it. And often there is. So we'll watch someone and, okay, all right, your abdominal wall's really low in tone, or this part of the system's not working well. I need you to do these exercises. Or it might be, or often there's a component of tightness or overactivity somewhere, because your abdominal wall's 4 layers deep. And it's not just one muscle. Yes. So there's 4.
I'd love to hear that it's 4. Okay, helpful.
4. And those 4 layers connect all together in that centerpiece down the middle called the linea alba, and that's the piece that will sort of stretch and separate. If you're trying to prevent that separation, you've got to consider the function of all 4 muscles, right? So we just kind of look at someone's body, analyze it, figure out what we can do to make sure for that woman we do the best we can in that pregnancy to be as preventative as we can with the diastasis. So it's good to start that in the second trimester. And then, as I said, we'd assess your pelvic floor too, because again, we don't know what we're going to find. When you assess someone's pelvic floor, again, most people would just assume you're assessing the strength probably, because that's the most thing that talk. But actually, we're assessing so much more than that, because muscles do more than just contract. They have to relax properly. They have to time their contraction properly. They have to be able to work under load and different speeds. So we're testing lots of different components of the function to test if there's something that we could intervene with, and then optimize basically. So the second trimester is pretty smooth, pretty easy. Usually don't need to see the physio much unless there's something going on. It's just like, this is your program, and usually we'll say, I'll see you at about 34 weeks, all being well. And that's when we, again, look at the abdominal walls or anything else I need to do, because sometimes we will put someone in tubey grip or some sort of compression stocking in pregnancy. So if we've done all we can do, but there's 2 babies in there and this abdominal wall is really heavy and it's really stretching, we might compress someone with a tubey grip, which is just like a piece of, I think everyone knows what's like stretchy compression stocking, but it goes over your abdominal wall. So it comes in sizes, big sizes, and we usually double it up. And so sometimes we'll see someone at 34 weeks and be like, far out, I need to give you some more support. Put this on. This will make you feel loads better. And it's also plugging the abdominal wall in and trying to stop that linear alba just stretching too much. There will be space. The linear alba is going to stretch. It can't not stretch. There's just this point with we're like, oh, we just don't want to go too far. It's hard to come back from too far. So we like to watch that. We have measures that we take both with our hands and with a real-time ultrasound, just to be like, okay, where is this? How are we going? What else could I do? Yes, we'll assess that again, and then we'll assess the pelvic floor again. And the main measurement that we're really interested in at this point is how well the pelvic floor is lengthening. So this is in the case that someone is electing for a normal vaginal delivery, so going for a normal vaginal. If you're at that point that you're electing for a cesarean section, then unless there's some sort of dysfunction in the pelvic floor, then that assessment's not so necessary. This is if we need to make sure the pelvic floor is doing exactly what it should do for your labour and birth, which is stretch 3 times its resting length.
Very important.
And essentially get out of the way of the baby's head to descend down and through the vagina and out. So we just need to know that these pelvic floor muscles can switch on, they can switch off, and then they can lengthen under the load of what's called the bearing down maneuver, which is like pushing in labour. So we're huge advocates for teaching women how to push in pregnancy, which has been proven in the evidence now that that's a good idea. But we've done it for a long time because physios, we think about muscles all the time. So we've always thought, gee, it wouldn't be great, would it, if you had this group of muscles that just didn't stretch very well and didn't know how to get out of the way? And surely if that's the case, there'd be some sort of trauma or some sort of issue during the birth if it didn't. And so that has been proven now that your second stage of labour, for example, the pushing phase, will be longer if you don't push well and if your pelvic floor muscles don't know how to get out of the way. So now the problem with a long second stage is that's stretching all of your tissue inside your pelvis. So over and over again. Now, what we worry about are the ligaments and the fascia that are holding up your pelvic organs. So your bladder is in there, your uterus and your rectum are all held up by these nice strong ligamentous structures that just, if they get stretched and stretched and stretched over and over and over and over again, for longer than 2 hours, let's say, then they don't bounce back as well as we like them to bounce back, and therefore they don't hold up your pelvic organs very well. And what we worry about is pelvic organ prolapse in the future. So that's why we're a bit obsessed with the length of that second stage. How long are you pushing for? And could we make that a bit more efficient if you knew how to push well? And the other thing is for years, women would come back and, tell us about their birth, which is like our favourite part of our job, listening to people's birth stories. And they'd be like, but they kept telling me I was a terrible pusher. And we hear that thing over and over again. I'm like, it's not that helpful to learn that you're a bad pusher in the middle of pushing, whilst you're trying to push your baby out, for someone to say you're not pushing well, and you're thinking, well, I've never done this before. No one taught me how to push a baby out. I don't know. And it's really painful.
Yeah, I imagine it's a little bit too late to be told, and you'd be so exhausted.
So tired. Yeah. So that's what the third trimester looks like, really, from our point of view. And you're still exercising, by the way. You're all still exercising.
Yeah. I've got a couple of questions there, but my mind is boggling a little bit there, but I've got 3 questions that I want to follow on with, so just give me a quick moment and I'll get this. Okay, so Jo, those are some really interesting points you just gone through, and I think specifically I'm thinking again about multiples and birthing your babies, and you've talked about the abdominals and basically preparing that. I think that's a really, really relevant call out to people having multiples, is that preparation, especially if there's that added weight load. So really loved that. And then the pelvis stretching for birth. I mean, I just had no idea, which probably a lot of people don't, but going in and having a birth and not knowing that it was probably never going to go well if your pelvis wasn't able to stretch, it's actually quite concerning. It's almost like that should be the first check. I'm quite surprised that that's maybe not more well known, or it isn't, and you can potentially prepare. And then the other one was, you talked about a long birth and that kind of overextension of the muscles and then that bounce back. If it doesn't bounce back, we've got issues like incontinence, etc. So I wanted to highlight that to the audience as they're listening. Some really, really interesting points there. And again, I think for multiples, those would be quite important. Was there anything you wanted to add with that, with multiple specific muscular considerations or things to know about for those sorts of births?
Maybe just with the abdominal wall piece, I think if it's your first baby, and maybe if you've sort of just not been around much chat around abdominals, it doesn't necessarily sound like a big deal, and it can be again washed over as like an aesthetic issue, and it is an aesthetic issue, but it makes you feel really awful. So because your abdominal wall can end up looking really sort of low in tone and floppy and doesn't make you feel good. And it's definitely been proven to women with a bad diastasis or abdominal separation. It has strong links to postpartum depression and obviously body image. So from a mental health point of view, from a physical health point of view, physios, we argue it's absolutely important because those structures are holding you upright. This is important, but it's definitely been washed over, probably medically, because it doesn't cause any massive issues medically, but mental health wise, absolutely it does. And so I think just really have a good think about it, because it is often very preventative if you do the right exercise, and it will be worth it for you to come away from your pregnancy with an abdominal wall that you're still happy with. And I think you said, Emily, that you're happy with your abdominal wall past postpartum than you were before. Yeah, and I am too.
Surprisingly. I thought it would be just slow.
Yeah. So there's also the argument, and I've got patients the same, who actually go, my abdominal walls are better than it's ever been, because I guess you pay attention to it. Like, as I said, if you rock up to a physio who's good, they're going to analyze it and figure out where the dysfunction is and try and piece your abdominal wall back together. Often we get really grippy overused, dysfunctional, superficial layers. So the external oblique is one of the, like, of the four, it's the fourth layer. Well, it's actually the third, then there's rectus abdominis, but it's more superficial, and it can get really overactive and dominant and tight, and people end up with what we call a little pressure belly. So they just sort of say, oh, I've always had a little pot belly. What that says to us is your abdominal wall is actually very dysfunctional, and your deep core is not working at all because it's being shut down by the overactivity in the superficial system. So all of those, I suppose, the biomechanics of your abdominal wall we can fix. And if you've got time in pregnancy, it's a great time to fix it, because we can also prevent the big diastases through the centre and hopefully turn out like us and be like, actually, my abdominal wall post baby's better than it ever was. Yeah, but it's it's aesthetic, but it has far greater consequences when it's bad. So pay attention. And the stretching piece, pelvic floor mobility, I suppose, for birth isn't, as you say, very well known about. It's because it's taken a long time to get the research to show that it's important. And that's part of my PhD as well. And as such, it's not taught in obstetrics or midwifery practice. And it will be taught in the coming years, because we now have enough evidence to say, yeah, guys, this is really important. And it's actually very easy to assess, obviously in the hands of someone skilled, but it's not a difficult thing to assess that has, again, a bit like the abdominal wall, potential to prevent something really bad like stress urinary incontinence, pelvic organ prolapse, bad perineal tears, etc. So something seemingly basic, certainly in our world as pelvic health physios, it's quite a basic assessment now. It's not a difficult thing to do. And then if someone needs treatment, the treatment is also not difficult, then we can prevent some really terrible outcomes. I think in the next decade or so, it'll hopefully be more mainstream. But we have to, like everything in medicine, you have to get some evidence behind you before it's taken seriously. So it's happening. It's good.
Well, I'm glad you're leading the charge on that. I'll certainly be spreading the word through this podcast, but also I'll be telling everyone I know, because that's terrible that it's not more widely known. One other thing that I would also highlight is I do know that in the multiples community on the group pages, there are just so many posts of people that, like you said, they're just really so upset with their bodies. It's really sad. You see someone post, I hate my body, I'll never go to the beach again, I'm always covered up, stretch marks, etc., stretched skin, abdominals dropping, and you see people post under, and it's the same. And that's one of the things which drove me to wanting to try and help people get more information. And I accidentally, as you said, have better abs than I did before I had babies. And that's purely, I'd started Pilates, which is very deep core focused. Prior to that, I didn't really have strong abs, to be honest. But I happened to get pregnant after that with the twins. Physio through the pregnancy can be quite expensive for some people, but we'll talk about some cheap options later. I think talking about the mental health, even for any partners listening, why you might advocate for that, I think is really, really important, especially in this community of multiples or new parents.
Yeah, absolutely. And I think hyperemesis gravidas, which did you have as well? Were you sick through your pregnancies, did you tell me? Yeah. And I mean, it's far more common, obviously, when you've got multiple babies. So my heart goes out, because I was the same, so sick, and I knew all of the things that I should have been doing in terms of exercise and what I shouldn't eat. And I just couldn't do any of it because I just couldn't get out of bed, all the things. So it's easy for me to sit here and say, get up, go for your walk, go to the gym, eat well, la, la, la. But I just want to say, first of all, I appreciate that for some people, pregnancy is not the time that you can even think about looking after yourself, and all you've got to do is get through the pregnancy. So that's fair. So it's just for those that can, you exercise and get to the physio. Great, best case scenario. For those that can't, then you'll feel $1 million once you've birthed these babies, and you'll be back to yourself. And then you get to the physio straight away. So there's a bit of a 6-week check at the physio. We've moved that forward over the years. You're like, you know what, I'll see you at 3. Because
breaking news.
yeah, I know. Well, it's a bit of, I don't even know where the 6-week thing came from. It's probably on the back of the 6-week check with the midway.
Oh my gosh.
Yeah. I don't know, because, you know, midwives, GPs.
Jo.
I know, but if you think about it, if you've got an abdominal wall that I'm worried about, we've got no time to lose. So if you can get out of the door and get to the clinic at 3 weeks, then I want to see you then, because I know you're trying to still get your feeding established. I know you're really tired. I know all of that. But I also know there's a few little things that we can do and start it really early that's going to be really helpful. So again, we might get you in a tubey grip. We might order you a specific pair of shorts or tights. We might get you, we'll get you started on your exercise program, which will be, we're not silly, and most of us, not all of us, but you know, a lot of us are mums, right? So we've all been there, we get it. You have zero time, but we do cheeky little fun things. Well, the TheraBand that we might be giving you, which is a resistance band, an abdominal exercise that we might have got you doing lying down, we'll get you doing standing up with the TheraBand, and we'll get you to put it around the doorknob in the kitchen so that when you walk past it, you can just do 3 of them. So we try to be really creative and clever with how we integrate these exercises into your life, because we're not silly. We know that it's just impossible for you to lie down on your Pilates mat with especially more than one baby and get your exercises done. So we're integrating it through your life. But the sooner we can see you postpartum, the better. And obviously, if you do have access to physio, we will, I suppose, be your guide, like your exercise guide to build your body back. And this is obviously in the case that wasn't able to prevent all of it happening in the pregnancy because of whatever else. So yeah, so I suppose, because there's also you've had your babies, of course your body's floppy and fragile, and I suppose my message is, don't accept that and wait until you get to 6 months post and look in the mirror and go, oh my God, my body. Again, easy for me to say, but if you can just spare a thought for yourself in the early days, just a little bit, because if we can get working with you sooner, I think for a lot of women we won't have that same looking in the mirror at 6 months hating your body situation, because we've worked really hard with you for 6 months and you'll feel much, much better at 6 months. So that's, again, probably ideal. If you're listening to this and you're already 6 months down the track and you haven't done anything, then that's okay. Get going now, get going. Because again, we've seen patients over the years where they come in 2 years post and they're like, right, I'm ready. And I'm like, far out. This is okay. But I'll say to them, this is fine. It is what it is. We're here now, but it will take us a whole year to get to where you want to be. So you're going to have to be patient with me, because we have to start from scratch. So yeah, I guess the message is where possible, earlier is better.
Yeah, that's really good. And I was going to ask you about that, because I think it's good to know. I mean, I think my mother was a twin mum in the 80s, and she didn't get her stomach fixed until we were 4. But she said, look, I just didn't, not necessarily the knowledge. She was looking after the twins and had another child as well. So spreading the word as much as we can about why you might prioritise that, and also to partners, because today partners are a lot more aware of advocacy. So knowing about the situation so we can give you education, but also knowing people have got those limitations in terms of they've got other children, maybe not support, maybe they're a single parent with multiples, maybe located in the bush and not a lot of options. So hopefully this episode today gives people information and that you do the best you can. At the end of the day, as long as you're taking a step forward, it's not backwards. Or even if you go backwards and you go forward again, that's hopefully the main message to go through today. We all do our best.
Yeah, absolutely. Exactly. And you can't beat yourself up. That's not helpful. the things that partners can do is maybe just take a bit of the load. That's not the right word, the cognitive load. So, for example, you might know you really want to get to the physio, or you might know that you want to do some research on some great postpartum exercise, but you just can't quite, I remember that, just can't quite execute the task. You've got it's like, I know what I want to do, but I just can't even, I can't even open the computer anymore. I don't even know. So I feel like that's a good job for the partners to be like, okay, you know what, I'll book that appointment for you. Or, hey, I've done this research. It looks like there's X, Y, and Z on the market. What do you think? And then, why don't we make a plan that at this time of the day, every day, you have your 10 minutes to do your exercise while I do whatever with the babies. It's a bit like in the birth as well. We always advocate the partners need to be the brains. You are thinking, your partner is way too busy feeling and trying to just get through this labour. We don't actually, in labour, you don't want the woman to go to cognition. You don't want her in her frontal lobe. You want her way back in a primal brain just doing her thing. So they have to think, and especially in those first 12 weeks, all you can think about is feeding your baby, really. So you need someone else. I'm going to prioritise you. I'm going to look after you. You look after the babies, get them fed, and I'm going to look after you that's the dream.
Yeah, those are great tips. I remember when I was at the hospital, one of the nurses or the midwives had said to me that the brain goes into a state where it's purposely takes you further away from the logical thinking, which must be the parts of the brain, which I have read about previously, and more to that keep the child alive, which is, again, humanity. Any animal that exists that's what the mother's job is, apart from maybe the animals where the male takes over after birth. I don't know the mechanics there.
I don't know either.
Generally speaking. But that's a great call out, that advocacy. And we talked about this with the OB, so Dr. Sarah,
Yes.
around what partners can do, being that logical person. And then something I thought of, which I think you might like, is gifts. When people are thinking about what they can get for new parents, buy them vouchers for a physio. I don't even know if that's possible.
Yeah, it is. For sure.
Wouldn't that just be great?
Great idea.
And it's pre-organised, and then you don't have to think.
Oh,
you just
just make the booking and here's the voucher. It's all paid for. Oh, what a great idea. I've never really thought of that. But yes, your postpartum check with the physio voucher. Nice.
Yeah, well, I spoke to a breastfeeding expert recently, and she had said her top tool was actually services. So get a voucher or whatever it is, whether it's breastfeeding support, sleep training, physio.
Yes.
That is much better than buying 10,000 twin or triplet, etc.
Outfits.
Feeding clothes.
Yeah.
Oh my God, yeah. There's so many gadgets. I think that's a really nice call out, and people will note that one down, guys. So we've gone through the pregnancy trimesters and we've talked about some top tips, so many great tips. I can't believe how much I'm learning. And then let's talk more about postpartum. I want to go through my story because I think that'll be a good illustration to educate people why they might want to see a physio, which I think hopefully they're already on that journey. So I had seen a couple of physios before. I had friends that were physios. I've done a lot of sport and ballet and things over the years, so I kind of knew about the body-ish. Well, I thought, anyway. I'd seen physios and I was just a bit confused. It's a bit uncomfortable as well, let's be honest, you've got doctors and everyone's poking around down there.
Yeah,
and
true.
Yeah, I saw people but never quite, I guess, got it and didn't think it was that important, to be honest. And then I had twins, really big twins, and my ribs twisted, my spine twisted. I didn't really know, I just had bruising and things like that. And then what happened is postpartum, I went back to my Pilates instructor and she just happened to be there that day. And she's really well educated, and she looked at me and she said, your hips are twisted and your legs turned out. And we were looking in front of a mirror. I was like, oh, are they? Obviously clueless, still in the fog. And so she recommended I go and get massage and stretching to kind of balance the body. From that, I ended up seeing a chiropractor who scanned my body, did a full skeletal scan, and I had scoliosis. So my jaw was twisted over, my neck was twisted, my spine was twisted, my ribs were lifted, I think is the right term. And I was getting headaches and pain. And I ended up then going to see a physio who was great and has been working to straighten me out, plus the Pilates instructor. They're constantly like, let's flip your hips, but all by accident. And post that learning, I really speak to a lot of parents and even women that had kids years ago, so my mum's generation, and they've never done anything. They've got pain and they've got headaches, but they just keep going or they medicate. So I wanted to share that with people as an example of the fact that I understand it's expensive, I understand it takes time. So again, like, let's do what you can, or we'll talk about some options there. But you can get quite a lot of issues if you're not checked, or you can have pre-existing. I think for me, I was probably pre-existing, maybe twisted. I actually don't know, but probably. And then it was exacerbated by the pregnancy. And I was getting these headaches. I was a runner. I'd run and then I'd have like 3-day migraines. It was crazy.
Awful. Yeah.
Yeah. And with these sorts of issues, I'd be interested to hear from you generally how you might approach someone like me and what you would explain to people within that scenario, as well as to why they might want to consider getting checked early, or asking families for a voucher, or doing a remote check or something like that.
Yeah. I think it's exactly the same theme that we've got through the whole podcast, which is if there's a symptom in your body, it's telling you something. And yes, we can just take a Panadol and try and get rid of that headache. But if you do understand your system, and I keep talking about the systems because the body is a whole system, right? And as pelvic health physios in our clinic, we still look at the whole body from your feet to your head, because like in your case, you could have had, with all of those twists and turns in your system, you could have had anything wrong with you. You could have had headache, you could have had stress incontinence, you could have had a right hip pain, you could have had rib pain, you could have had anything. So the symptom doesn't often tell us much until we see the body, and then we look at you. So yes, I would have looked at you too and went, okay, wow, your pelvis is here, your ribs are here, your head's here, far out. What can you do? And then we get you to move, and oh, good grief, no wonder you got headaches when you run. Look at you stand on one leg. But that's okay, because then you understand the system. Okay, that's all right. It's all biomechanics. Let's rewire your system a little bit, and that always often involves some sort of manual therapy, and always involves exercise. So, and exercise truly is medicine. It honestly, if you've prescribed the right exercise program, it's worth its weight in gold, and it's cheap. So you're right, the massive barriers for everybody is finances and time. And that is an issue when you're going to see physio, because usually you're going to have to seek out private physio, and you're going to have to give up an hour of your day. So, but if we can see you as sooner in the piece, rather than when you've got migraines, when you're starting to get some symptoms, or in the case of postpartum, even if you're asymptomatic, you have just been through pregnancy and birth, let us just assess you. And that might be it. Or it might be that you say to us, listen, I can afford to come back once. And I go, all right, these are the exercises you do. If you do them every day, you will get better. And then we see you one more time to progress the exercises or tweak it or whatever. So it doesn't have to be a commitment to every week. So don't let that put you off. If you think you're going to the physio, don't roll your eyes and think, oh, I'm going to have to go there every week for like 12 weeks. It's going to cost me $1,500. It's not the case, especially if you're postpartum and you're asymptomatic. It might just literally be, hey, listen, we need to work on X, Y, and Z. You've got a month. You do the work, we'll get you better. So it doesn't have to be as costly as you think if you're kind of clever.
That's great. Really great to hear that. And I hope people enjoy getting that insight, because for some people it's a real issue. Certainly those who have multiples and other children and they just don't have the income.
Time poor, yeah.
Divorce early is another common one, unfortunately.
Gosh.
Yeah. Anyway, we're good.
And you know what? Like, just putting it out there, we have kids in our clinic all the time. Babies and children are welcome. Our admin team and our reception staff are unreal. They're rocking prams. They've got one on the hip and they're rocking this pram, and we're all in it as a team to help facilitate the health of this woman. So don't also let that put you off. It's hard, I know, but if you're going to a great clinic, the babies will be welcome, the children will be welcome.
That's really nice to hear. And I have seen that even with going to Pilates classes as well. If it's a good place, wonderful people, especially if they're parents, they know.
Absolutely.
Those people are amazing.
Yeah,
Thank you
it's
for that,
great.
though. Luckily, my body is in a much better place. So I highly advocate for people to do what you can. Do you ever do virtual checks, or is that just completely impossible? If someone, say they're in like remote Northern Territory and there's just not a good women's physio there, could that person dial in and get some sort of help, or is that
Yeah.
a challenge?
No, I mean, it's definitely a challenge because of the obvious, because we like to see and touch and feel a body to understand it. But COVID taught us that we can do anything online. So we definitely do telehealth, because there definitely are those scenarios. In the very least, we can take a subjective history and just try and get to the bottom of what's happening from that perspective. And we can certainly look at movement patterns and things through the screen. And then we will do our best for that person to find them the most accessible pelvic health physio we can. So we're all very connected. So we usually know where they can find someone. So we've certainly had that scenario, and often people will end up flying into Sydney just for at least a one-off assessment or something like that. But honestly, there's some really amazing pelvic health physios around the whole country now. It's become quite a strong profession. We can usually find someone close enough for people.
Great news, great news. Okay, and I wanted to, for a positive piece for the audience, what's an example of someone who's come in, had a whole host of issues, maybe they've left a bit late, and you've been able to turn that situation around so people really feel that difference in terms of what it might make for them?
Oh, far out. There's so many. I'll tell you one story because it's fresh, and it's actually talks to your point around rurality or remoteness. And it wasn't a case of mine, but we often within our team share cases amongst each other, particularly, well, we call them wins, because it boosts everybody. And this was a case, she'd come from like far north Queensland. So she had a pelvic organ prolapse plus incontinence, and so therefore couldn't run, couldn't even do a whole lot of just activities of daily living before she needed to sit down from being symptomatic of her prolapse, which is a heaviness, dragging, awful feeling. I'm trying to think what else. There was another limitation, but there were a couple of like really life-changing limitations. And for a lot of women, exercise is really important for our mental health. We know that. And when you can't do it because you're limited by your body, it just feeds this awful cycle of depression, really. And so for whatever reason, the assessment that was done wasn't spot on. And so by the time she saw my colleague, she could figure out what was going on, and all she had to do was fit a pessary, which sounds really complicated, but not. It's the most basic little splint that we use, and it does go in the vagina, so that makes it sound complicated. But essentially it's a splint that we splint the organs up. And often the prolapse and the incontinence piece are actually related. So if we splint up the uterus, we splint up the bladder, we can close off the urethra a little bit. We suddenly have this woman who has no symptoms. She's asymptomatic. She's not incontinent. She doesn't have any prolapse symptoms. She can run. She had pain as well, because that's right. Because once your organs are dragging, it's heavy, but it can also wind your pelvic floor up, because your pelvic floor is gripping onto this organ for dear life, and that then creates a pain in the vagina, in the anus, wherever. So she had those three symptoms, and that pessary, boom, sorted her out. And so within the case of 45 minutes of just doing a thorough assessment, fitting the pessary, the woman's back running, she's asymptomatic, she is sent, I know about it because she sent my colleague an email telling her that she's changed her life. So wow. I think that's a good story, because it demonstrates that, yes, we can make it work if you're coming from somewhere other than around our clinics or around and B, often the treatment is really simple for symptoms that are really bad. People always assume that when your symptoms are severe, the treatment must be equally difficult or challenging. But honestly, the treatment we do is easy and often really helps some severe, debilitating symptoms. So that's one good story.
That's so impressive. That's so impressive. So for anyone listening, or if you've got parents that had babies later, or friends, aunts and uncles that whatever, that haven't been in a time where they've fixed it for whatever reason, or if you've had it, that's a really good news story. Does the body ever go back to a pre-pregnancy state? Is that a thing, or what's the timing as well?
I mean, does the body ever go back? Does the mind ever go back? It's hard. It's a hard question to answer because, as the same is true for you, we often don't know what the pre-pregnancy state was. Unless we have had the privilege of seeing that woman through her adolescence and 20s and really understanding her body, we don't always know what it was like, because we often meet them in pregnancy or postpartum. So like you said, I don't know if I was twisted before. You could have been. I don't know either. But we have this thing that we're like, we make bodies better than they've ever been. So,
that.
Yeah, and you go through your 20s and you really probably destroy your body a little bit. You don't care too much about it, and you start really having more respect for your body, I think, once you've watched yourself grow a human and then birth a human, and you're like, wow, I'm amazing. I should look after this thing that I've got.
I made life or a few lives.
Yes. So I don't know. I don't really know the answer to the question. I would just say embrace what you've got and really build on it and look after it, because you know, we've got it as women. We just have to keep ourselves fit and strong for ourselves and our children. We just have to. So yeah,
I agree. Fill your own cup so you can show up better for your families. Okay, so many great tips there. We've gone through that pregnancy, postpartum, when to get checked, some examples. Hopefully people have really enjoyed this. I have learned a lot. I thought I was starting to get knowledgeable, but apparently not. I've really, really enjoyed this. Thank you so much for joining, helping our audience. We've done a deep dive into all things of the body, pelvic floor, abs, and if they could text you your abs and your pelvic floor, they would say, thank goodness you tuned in today. So until next time, thank you everyone so much for joining. Jo, it's been an absolute pleasure. I'll add all your details and really enjoyed having you on today, so thank you.
No worries at all. Thank you so much for having me.